Are you a college student interested in the medical field, looking at going to med school, but worried about the debt that you might accrue, or just not wanting to go to school for that long? Well, I am, and that's why I'm interested in the field of physician assistants. Today, I'm here to talk to you about the rise of physician assistants in the U.S. over the last 10 years. My name is Kate Deere, and I'm a sophomore studying biochemistry at Bridgewater College. I've always been interested in the medical field, but I'm not interested in going to medical school. For that reason, I want to be a physician assistant, or a PA.
According to the AAPA, PAs are medical professionals who diagnose illness, develop and manage treatment plans, prescribe medications, and often serve as patients' principal healthcare provider. With thousands of hours of medical training, PAs are versatile and collaborative. The Medical School blog from St. George's University explains some of the differences between PAs and MD. While the autonomy of a PA varies between different states and different practices, PAs and MDs essentially do all the same things. Each conducts sick visits, physicals, routine check-ins, writes prescriptions, and even performs minor procedures. However, when more complicated procedures and medical decisions are involved, PAs must consult an MD. PAs and MDs also go through most of the same training prior to working in the medical field. Both go through intense in-class training as well as various clinical rotations. Both are extremely important to the field of medicine and play their own role when it comes to patient care.
In the last 10 years, the number of PAs working in the medical field has drastically increased. More hospitals, clinics, and even specialists are utilizing PAs to work with and care for patients. But before I can delve into that, I first want to give you a brief history of the physician assistant field. No one had heard of a physician assistant until the late 1960s. In the early 1960s, there was a growing shortage of primary care physicians in the U.S. So Eugene Stead Jr., an MD from the Duke University Medical Center, began the first ever PA program in 1965. 2 years later, 4 students graduated the PA program, entering the medical field as physician assistants. By 1973, there were 300 physician assistants working in the U.S. who joined together to form the American Association of Physician Assistants, or the AAPA. In the last 10 years, there has been an exponential growth of PAs working in the medical field. A study conducted by the Commission of Education for Physician Assistants showed that from 2008 to 2019, the number of PA programs in the U.S. almost doubled. In 2008, there were 142 PA programs, but by 2019, that number had grown to 246 PA programs. The demand for PAs has significantly grown, thus requiring more PA programs to be established. The AAPA last December reported that there were 250 accredited PA programs, and that each year approximately 9,000 students were graduating and entering the medical field. Now, let's talk about just the last 5 years. The NCCPA publishes a report every 5 years regarding various demographics of PAs working in the U.S. In 2013, they reported that 95,000 PAs were currently working in the U.S. Then in 2018, that number had grown to over 130,000 PAs. This is a massive change in the number of PAs working in the field. It's a 37% increase in only 5 years. Now that we have established the immense number of PAs working in the medical field, let's talk about where those physician assistants are working. Not all PAs can work in a family practice or in a hospital. If that were the case, then anytime you went to go get a checkup, a physical, or had to go to the ER, you would only see physician assistants. Instead, many PAs are working alongside specialists. One of the wonderful things about being a PA is that as a PA, you do not have to return to school to specialize in any given area of medicine. This is also very important to any of you who may be needing or in the future need an appointment with a specialist. With more PAs working alongside specialists, the wait time for an appointment is generally shorter. Rather than having to wait a few months for an appointment, you may only have to wait a few short weeks. In this video, I have given an explanation of how the field of physician assistants began, their growth in the field of medicine, as well as the opportunities for PAs to specialize in various specialties. For me, being a PA will allow me to have hands-on experience with patients, as well as gain experience in numerous specialties. For you, you may not want to be a PA, but you are likely to see them more and more in medical practices and in hospitals, and the next time you run into a PA, you will have a better understanding of the important role that they play in medicine.